Before watching my video, please subscribe my channel and don't forget to click on bell icon to get notified all latest updates and notification. If you liked this video, give a thumbs up and share with your friends. Post your comment below. Glucose tolerance test. All pregnant women should be screened for gestational diabetes during their pregnancy. Screening may be done by taking the woman's medical history and examining certain risk factors, but an oral glucose tolerance test is also recommended. A glucose screening test is a routine test during pregnancy that checks a pregnant woman's blood glucose, sugar, level. Glucose screening is usually done between 24 and 28 weeks of pregnancy. For this test, there are several tests intended to identify gestational diabetes in pregnant women. If a woman tests positive during this screening test, the second test, called the glucose tolerance test, may be performed. This test will diagnose whether diabetes exists or not by indicating whether or not the body is using glucose effectively. The glucose challenge screening is now considered to be a standard test performed during the early part of the third trimester of pregnancy. What is the glucose challenge screening test? No preparation is required prior to the test. During the test, the mother is asked to drink a sweet glucose and then will have blood drawn 1 hour from having the drink. As blood glucose levels normally peak within 1 hour, no fasting is required prior to this test. The test evaluates how your body processes sugar. A high level in your blood may indicate your body is not processing sugar effectively. Positive test. If the results of this screen are positive, the woman may have the glucose tolerance test performed. It is important to note that not all women who test positive for the glucose challenge screening test are found to have diabetes upon further diagnosis. Normal glucose challenge screening test result. A normal fasting blood glucose level is lower than 95 mg/dl, 5.3 mmol/L. 1 hour after drinking the glucose solution, a normal blood glucose level is lower than 180 mg per deciliter, 10 millimoles per liter. 2 hours after drinking the glucose solution, a normal blood glucose level is lower than 155 mg per deciliter, 8.6 millimoles per liter. 3 hours after drinking the glucose solution, a normal blood glucose level is lower than 140 mg per deciliter, 7.8 millimoles per liter. If one of the results is higher than normal, you'll likely need to test again in 4 weeks. If 2 or more of the results are higher than normal, you'll be diagnosed with gestational diabetes. Thank you for watching my video. If you liked my video, give a thumbs up and share with your friends.